In this video, we'll discuss about tetanus. So first of all, coming on to the definition of tetanus, it is a non-communicable infective condition characterized by reflex muscle spasms and oftenly associated with tonic-clonic convulsions. Now, the causative agent of tetanus is Clostridium tetani, we all know. Now, we will just mention something about it. Basically, it is a gram positive anaerobic spore forming bacteria. It is motile and it is non encapsulated. Also, when you form the culture, it basically forms dumbbell shaped colonies, right? So, right now, coming on to the pathogenesis or how it is caused, right? Etiology. First of all, it can occur from the mother to the child, okay? Prenatal or umbilical spread. Then, a very common one is through injury, that is road traffic accidents. Then another one is when a person has rusted nails. Then there is another one in which there is an endogenous infection after endogenous infection after septic abortion. We will discuss about all the types as well, and then you will know that there are more etiologies to it. All right. Now, after etiology, I will tell you the pathophysiology. All right. So, in what really happens is, first of all, what we see is there one thing you must remember, that tetanus is a wound infection. Okay, it's a wound infection. So, if there is no wound, no infection. This is very characteristic. Now, what happens is the spore, it enters the wound. Then it proliferates or it germinates in non-anaerobic medium, releases bacteria and multiply. Now they release exotoxins. Now here is the very important part. Now when these exotoxins are released, they are tetanospasmin and tetanolysin. All right. Now this tetanolysin, it will help in hemolysis. Okay. Now this has two routes, right? One is that it will go into the circulation, and another one is that it will go through the perineural sheath. All right. Now, when it goes through the perineural sheath, what it does is it blocks cholinesterase, blocks cholinesterase. Now, if it has blocked cholinesterase, what it will do is it will cause the hyper excitability. So there will be reflex spasm and tonic-clonic convulsion. All right. Then in the circulation, same effect. It is going to block the cholinesterase and then it is going to aggravate the muscle spasm. Now, a very important thing to remember is that if by chance, if the toxin gets fixed to the nerve tissue, antitoxin will have no effect. Now coming on to the incubation period. Now it is of 7 to 10 days. Now, what I need you to remember is that the shorter the IBP, poorer the prognosis. Okay. Now let's talk about the types of tetanus. Now in types of tetanus, we have a lot of types, and I mentioned them uh, one by one. Special types. All right. So first I'll just write the names. One is the early tetanus, then late tetanus, latent tetanus, right? Then we have ascending tetanus, then we have descending tetanus, then we have uh, perpural tetanus, then we have post-operative tetanus, then we have bulbar tetanus, then we have otitis tetanus, then ascending descending is done, then we have cephalic tetanus. All right. I think I have covered all. Yeah, one is left. Tetanus neonatorum and urban tetanus. One is missing. Um, all right. So starting with the early tetanus. Now it is a very severe form, as I told you, that shorter the incubation period, then poorer the prognosis. So it is a severe form and it has poor prognosis because it has short incubation period. Then in late tetanus, what happens is this develops months or even years after injury. Then coming on to the latent tetanus. In latent tetanus, what happens is the wound, it heals and is forgotten. Then after years or months, if there is a favorable environment, then there is release of all the exotoxins. However, release of exotoxins, however, it has a favorable prognosis. Now coming on to the ascending tetanus. Ascending is basically this. So from below to upwards, the manifestations, okay? And the opposite of this is this. Then purpural tetanus. Now this is important. This occurs when there is, this is basically a complication of abortion. Complication of abortion or purpural sepsis. Then post-operative. Now post-operative usually occurs because of the improper sterilization of instruments. Improper sterilization of instruments. In this case, there is a chance of 100% mortality. Okay. Then in bulbar tetanus, what we see is in the respiration and deglutition centers. Now, in cephalic, it is basically of head and neck region. In this, you need to remember one very important thing, that 3, 4, 6, 7. These will be paralyzed. Okay, these nerves, cranial nerves, paralyzed. Okay. In otitis, this basically is in occurrence with the chronic suppurative otitis media. Now, this is very important. Tetanus neonatorum. Now, what happens is it occurs through the umbilical cord of the non-immunized mother. Umbilical cord by non-immunized mother. So, what happens is it is usually seen on the 6th to 8th day. Okay, 6th to 8th day it is manifested. Now what happens is, so it is called as the 8th day disease. 8th day disease, and there is 100% chance of mortality. Now in the urban tetanus, what we see is it is basically seen in the drug abusers who use IV line for taking drugs. So IV line drug abusers. Okay, now let's talk about the clinical features. Now in clinical features, first I'll mention certain symptoms and then we'll discuss about the signs. Now signs are very important. All right, so signs. In the symptoms, what you get to see is you will see jaw stiffness, locked jaw basically, then delirium, dyspnea, dysphagia, pain and stiffness in neck, anxiousness, sleeplessness, headache, sweating. Now coming on to the signs. Now signs are very important. So the first sign is trismus. Why is it so? Because it is basically the inability to open the mouth. It is basically due to the spasm of masseter and pterygoid muscle. Okay, then there is one very characteristic keyword which occurs is rhizus sardonicus. Now this is basically the person appears to have a smiling face. Now why it occurs is because of the spasm of the facial muscles plus the zygomaticus major. Okay, now another sign which you get to see is hyperreflexia. Hyper reflexia. In this, what we see is there is spasm of all muscles. Spasm of all muscles. Then there are respiratory changes. Also, then you will trismus, rhizus ironicus, hyperreflexia, respiratory changes. Then you will get to see one more, which is the constipation. Yeah, it is constipation. Then you can also see urine retention. Now, why is constipation occurring? Because of the spasm of rectal muscles, and this is occurring due to the spasm or the paralysis of sphincter. Then very characteristic tonic and clonic convulsions. Also abdominal pain or abdominal wall rigidity, which is often seen to be causing hematoma. Then there is one more thing which is very characteristic, and you must remember it. So fever and tachycardia. Now, the one thing that I wanted to tell you is sometimes what happens is we see some features of carditis. Okay, now as soon as you see carditis, you give the steroids, but however, it can lead to cardiac arrest and then it can be a reason of death in a person who is affected by tetanus. Then, after this, we will just discuss a few stages, then we'll go on to the treatment. All right, so in stages of tetanus, we will divide them into three. First is the mildly ill, second is the severely ill or seriously ill, and then is the dangerously ill. Okay, now in the first one, what you will see is rigidity, spasm, trismus, opisthotonus. Now, what is opisthotonus is what happens is the posture of the person who is affected by tetanus gets affected, and this what happens is the backward muscles they act more. Okay, so there is a curvature. So in seriously ill, just mention spasm and rigidity. Then there is respiratory changes. Also dysphagia. Then in dangerously ill, respiratory failure, cyanosis, tonic and clonic convulsions. All right, now let's discuss the treatment fast enough. It is becoming a long video. So in treatment, what we see is first of all we will admit the patient, admit and isolated in a dark, quiet room. Then we will do the wound care, drainage, cleaning, debridement. Okay, then we will give an injection of toxoid, tetanus toxoid, 0.5 ml IM. Okay, then after this we will give ATG, ATG, anti-tetanus globulin, 3000 units. No test doses required because it is taken from humans as only. Then there is an anti-tetanus toxin serum. Now this is a horse serum, so there are very more chances that there is going to be an anaphylactic reaction. Now to test this anaphylactic reaction, what we do is we give 1000 IV. Okay, first we what we give is 1000 IV. We give it in half. All right, half and half, so that we can half is given IM and half is given IV. So the testos we see that is there an anaphylactic reaction, and then we later on give them more. Okay, basically, yeah. So then we will give Ryle's tube. Ryle's tube first for aspiration and then for feeding. Okay, aspiration, secondly for feeding. Then catheterization. Also, remember one more thing. The tetanus ATG is given 0, 1 to 6. Okay, 1 month later and then 6 months. Okay, then first at start. Okay, so this, and then very important to remember is that there is a very good nursing care is required, because to prevent bed ulcers. Now what are bed ulcers? They are basically trophic ulcers that occur because of the immobilization of the patient. Then we must remember that we also give certain other drugs as well. So certain other drugs are given in IV format. So in IV, what we do is, so what we give is, you can remember it by DPCCG. All right. So DPCCG. So diazepam, phenobarbital, then chloramphenicol, or sorry, chlorpromazine, crystalline penicillin, gentamicin. Remember the dosage. This is 20 milligrams, this is 30 milligrams, this is 25 milligrams, and this is in lakhs, 20 lakh units. Gentamicin as well as metronidazole, okay, so that we can clear the respiratory tract. Then certain patients, they require nasal oxygen, okay, nasal oxygen. Either we give them through the ventilator or endotracheal intubation, or we can also do tracheostomy. Then chest physiotherapy, steroids if carditis is suspected. Yeah. Now what usually happens is we have to give meth carbamol for 6 months to 1 year. Why we have to give it? Because you know what happens is, when we follow the treatment, right? What happens is the patient, he gets spasms of different muscles. Basically, we call them as tics. So, in order to relieve these tics, basically they occur at any time for a long period of time. So, to prevent them, we give methocarbamol. Now, coming on to the prophylaxis. Now, it is very important for the mother to be immunized. Now, we immunize the mother in the third trimester of pregnancy. Third trimester of pregnancy. How? We give her 2 tetanus toxoid injections, half ml IM. Okay. In children, there is DPT vaccine. Now, when it is given is, when is it given? 6, 10, and 14 weeks of age. Plus, booster doses are given 5 months. Sorry, 18 months, and then 5 years of school going age. Now, what is the cause of death in tetanus? Cause of death. Either it can occur because of, first is very important, you must remember, I have been speaking it so long, carditis, which can lead to cardiac arrest. Then, second is in the aspiration pneumonia. Okay. Then is when there is laryngeal spasm and respiratory arrest. So this completes the tetanus. I hope you understood. I try to make it as easy as possible. So thanks for watching.